have a bad dream last night? Maybe you were being chased or falling or drowning. Well, guess what? You're not alone. Doctors say most people have the same 10 dreams, just with different characters. Some of the most common universal dream themes include flying, transportation trouble, natural disasters, menacing spirits, falling, and being naked in public. Now here's Rob with some more sleep news.
All right, Sheila, thank you very much. You know, that's if you get to sleep. A lot of Americans have trouble getting to sleep. This Saturday, you will set your clocks forward an hour and essentially lose an hour of sleep. And millions of Americans are already sleep deprived, so they turn to pills to help, but do they really help? And what are the side effects? Joining me this morning is Sanjiv Patel with the Sleepcare Diagnostics in Eastgate. Sir, thank you very much for joining us.
Good morning, Rob. Thanks for having me.
How sleep deprived are we? How sleep deprived are all the people watching this morning?
Good question. From what the polls tell us, 50% of the people out there are complaining that they're tired.
50%? You don't have to be tired, though. Most people just go through life thinking, well, this is my life, I'm tired. A lot of people are tired.
Sure. And that becomes one of the hardest things that we see when we see patients is that they tell me, I just turned 50, I just turned 60,
sure.
I work 10-hour days, I'm supposed to be tired. And you have to take those things into account. But if you have someone who's working an 8 to 10-hour day, is getting a good 8 or 9 hours of sleep, and is still waking up tired, getting drowsy when they drive, times when they really should be able to concentrate, that's a problem.
Okay, now how can people find out if they're truly tired or just not doing the right things to fall asleep?
Well, you know, we talk about sleep hygiene issues and certain things, you know, keeping a regular rhythm to when you sleep.
That's sleep hygiene issues. We're not talking about clean sheets. Sleep hygiene issues are making sure that your rhythm is correct.
Exactly.
Going to sleep?
Good habits of sleep.
Okay.
Sleep is a habit, just like learning to brush your teeth every night. You know, you want to avoid caffeine and alcohol. You know, there's so many times you have patients that say, well, I drink a couple Dr. Peppers and go right to bed.
Right.
That's not good sleep hygiene, you know, or smoking before bed or alcohol to help them sleep. Exercise. Exercise is one of the biggest things that can help our body create a rhythm to sleep, but not exercising too late. You know, the 24-hour gyms, they actually can hurt you because if you exercise later, your brain wakes up.
A lot of people exercise right after they get off work and soon after they go to sleep. How many hours do you think should be the buffer zone between hitting the bed and exercising?
We tell most people about a 5 to 6 hour window.
Really?
Yeah, really that much, because what happens when you exercise, you raise your body temperature, and that raises your brain temperature, and it tells the brain, stay awake, something's going to happen.
What's some other things people can do to make sure they get a good
night's
sleep?
The other good thing is use your bed for sleep. You know, don't be the multitasker in bed where you're doing your laptop, you're watching TV, you're reading a book, you're taking care of the kids, you're eating in bed. You want your bed to be a place where you sleep.
I got a question for you. If you're in bed and you can't fall asleep, should you get up out of bed and do something else?
Great question. What we tell people is within 30 minutes, yes. Because if you sit there and toss and turn all night, you're teaching yourself, this is a place I can't sleep. I roll back and forth. Every night you start to create this anxiety, am I going to sleep tonight?
Right.
So yeah, within 30 minutes, if you can't get up and get out of bed, and then don't come back until you're tired. And if you can't fall asleep in 30 minutes again, get up and get out of bed again.
Let's talk about the drug a lot of people are talking about now, the strangeness with Ambien. You see people sleepwalking, sleep driving, sleep cooking, sleep eating, all while taking Ambien. You say it's a pretty good drug though, don't you?
Yeah, you know, in my practice and a lot of the sleep doctors I've talked to, you know, it's a very good drug. I think it's been out for years. We use it effectively, but you've got to use it in the right group of patients.
Okay.
You know, and you've got to know who to use it to. And you know, a lot of these cases are out there. We've seen some of these reports. You know, Ambien's been out at least more than 15 years, and there's millions of people who are on it. So it's a very effective drug in the right group of patients. One of the things we worry about is are you masking other disorders?
Sure.
Sleep apnea is one of the big ones. Patients who snore or hold their breath or gasp at night. These sleep medications can mask those symptoms and cause people to wake up in the middle of the night but have the drug on board. People not getting enough sleep at night. One of the biggest things we worry about in some of these cases you've seen is alcohol involvement.
Right.
You know, and what's tough with these medications is we do know it can cause some type of amnesia where when you take the medication you don't remember what just happened.
Right.
And there's patients who say they woke up and they found that there were bottles open of wine or beer, and sometimes it gets tough to know, was it that they were drinking before, or really was that happen? You know, there was a case in one of the reports I was there, and I've had a patient who's taken the medication at work, so by the time he drove home, he'd be sleepy to go to bed. So he's taking it before he's even driving. So
make sure you know what's happening with your sleep. Sanjiv Patel, thank you very much. He's a medical director of Sleepcare Diagnostics. There's one in Eastgate and one in White Oak.
Thank you very much.
All right. We have much more of the Fox 19 Morning News to come, including this. Meteorologist Paul Horton's going to have a look at your weather. It is wet this morning. We're going to check traffic as well as the Fox 19 Morning News continues.